What if the reason your inner sight feels dull, intermittent, or simply unreliable isn't a personal failing, but a quiet interference layered over the place where perception first tastes the world? How your pineal is being blocked without you noticing is not an accusation. It is an invitation to look, to test, and to reclaim a piece of yourself that has always known how to see beyond noise. Sit for a moment. Breathe slowly. Let these words move through you like a gentle searchlight, not a hammer. This is practical. It is experiential. You will be given a way to check for yourself, with nothing but your hands and breath. You will learn the story the old Gnostic texts tell about where this interference comes from, and you will be shown 3 simple marks on your body that, when touched and listened to, can confirm a memory that words alone cannot restore. If you follow this quietly and stop if anything feels unsafe, you may feel a small change, a flicker, a warmth, a sense of attention. And that small change matters. Long before established centers of power defined what counts as spiritual knowledge, certain communities kept a different map. According to the Nag Hammadi texts and the Gospel of Philip, there is a primordial source, a monad, a single, undivided origin of consciousness. And from that source, fragments of divine awareness scattered into many forms. Some of those fragments carried a clarity, a knowingness that remembered the origin. The story those texts tell is not history in the way a courtroom records events. It is a map of inner dynamics, a source, pieces of that source incarnating, and forces that seek to regulate, to intermediate, to filter the direct return to source. The texts name a secondary architect, often called the demiurge, and a set of attendant intelligences sometimes called archontes. The way these ideas are framed in human language can sound dramatic. Architect, rulers, guardians. But listen to the deeper suggestion. These are patterns, rhythms, frequencies of attention that insist you need an intermediary to reach the sacred. They habituate a posture of dependence on external authority. Over centuries, the texts teach, this subtle system learned how to dampen direct perception, to place layers between your raw sensing and the source it remembers. When we talk about your pineal being blocked in this frame, we are not delivering a medical diagnosis. We are describing an energetic dynamic, a pattern of interference that settles around the subtle center associated with inner vision. The pineal has become a symbol, a resonant place where the field of perception tangles. The work here is to notice, to verify for yourself, and to practice reclaiming that permeability, safely, gently, and without needing anyone to confirm your experience for you. To make this practical, the same body that can be clouded carries traces of its origin, 3 points or marks, that the Gnostic sources describe as signs of a pneumatic nature. These marks are not tattoos or labels. They are subtle energetic signatures that align with places you can touch and sense. The base of the skull, the place we will map to pineal sensitivity and third eye resonance, a line along the lateral side of the hand, the site of perception and extended sight, and a point above the sternum at the center of the chest, the seat of voice, command, and declaration. I will guide you through a step-by-step self-check. No equipment, no tests, no intermediaries. Just attention. Find a comfortable, quiet place. Sit with your spine upright but relaxed. Close your eyes if it feels safer. Slow your breathing. Inhale for a gentle count. Exhale long enough to release tension. You are training the nervous system to be present, not alarmed. Begin with the base of the skull. Place the pads of your fingers gently where the skull meets the neck, the very top of your neck, right under where the head rests. This area is sensitive to shifts in attention. Rest your fingertips there without pressing. Be as light as a moth landing. Notice the temperature of your fingertips, the weight of your hands, the subtle contact. Breathe and allow your awareness to widen. As you hold that place, listen inward for anything subtle. A warmth like a slow ember, a faint pulsing, a sensation of stillness gathering, a shift in how your inner visual field feels, perhaps a softening at the edges, or a felt sense of space behind your forehead. Do not expect fireworks. Most of what matters arrives as a whisper. If you feel nothing, that's information too. If you sense anything at all, even a small change, name it in your mind. Warmth, pulsing, lightness, attention. Now open your eyes and bring your attention to the lateral side of your dominant hand. The thumb side edge, running from the base of the palm up toward the little indentation by the wrist. Place your opposite hand fingertips along that line, tracing gently with curiosity. This hand line is associated with perception. It is the body's way of showing its capacity to receive signals that are not purely physical. As you trace, notice if the skin feels different there. A slight vibration, a dryness, a tender sensitivity, a sense of listening. Finally, rest your fingers lightly above the sternum, at the hollow just below the throat and above the breastbone. This is where voice and authority converge in the body. Place 2 or 3 fingers there with steady, gentle pressure, not hard enough to cause discomfort. Sense whether your chest feels rounded and open or tight, whether your breath meets resistance or flows, whether your inner chest carries a sense of calm readiness. Throughout this check, you may notice a rush of thoughts. This is nonsense, placebo, imagination, wishful thinking. That immediate dismissal is not a failure. According to the pattern the texts describe, that movement, the reflex to explain away, is often the interference itself showing its face. When a critical thought arises, note it like a weather pattern passing. Ah, there it is. Do not engage in argument with it. Observe. Let the thought be audible, then return to the sensation. That reflex is in fact a form of evidence. The presence of automatic dismissal often signals a layer of conditioning trying to keep things hidden. If, as you perform the check, anything slightly alters, a warmth at the base of the skull, a mild clarity behind the eyes, a sense of attention in the hand, a relaxation in the chest, do not immediately assign it meaning beyond this. Your system responded. Small responses matter. They are tethers to the possibility that the field of perception remembers how to open. Before we go deeper into why this blocking operates, let me anchor you in the narrative frame the ancient texts provide, briefly and simply. The monad, the first principle, scatters fragments into embodied forms. Some of those fragments retain a kind of inner knowing that does not rely on hierarchies. The demiurge and the archontes are patterns that set up rules for perception. What counts as valid? How truth should be received? Who decides what is real? Over time, these patterns can become so familiar they masquerade as ordinary skepticism or cultural common sense. They train attention to look outward for authority, to prefer certified explanations to inner verification. That is why bodies matter. The 3 marks function like an archive of belonging. They are not membership cards you flash at someone else. They are contact points for your own remembering. The base of the skull mark in this map sits close to the skull's axis of resonance, the place where the field of inner vision metaphorically tunes. When that area is muted by noise, by habitual doubt, by cultural instruction, by frequencies of attention that prefer separation, your pineal-related sensitivity is not damaged so much as shrouded. How does that shrouding feel in everyday life? It shows up as sudden, unearned doubt, when an inner nudge asks you to move differently. A sense that your intuition is unreliable. A habit of looking for experts to authorize the smallest stirrings. A clouding when you try to meditate. Or a sharp dismissal of subtle experiences as mere imagination. These are not moral failures. They are signs that attention has been trained outward rather than inward. You may have heard modern theories about environmental factors, fluoride, EMF exposure, calcification, as explanations for pineal dullness. These are commonly discussed theories and cultural narratives. They are not what this teaching asks you to test right now. We are focusing on subjective verification. Does your body, when attended to, give you any signal that remembers a different way of perceiving? The practical test does not require measuring electrodes or laboratory proof. It only asks you to notice what you can feel. Now, with that context, let us return to the 3 marks and describe them again with a slightly deeper sensory language, so you can recognize them in yourself. The first mark, base of the skull. Place your fingers there again. The mark will not be visible like a bruise. It will be felt as a subtle center of resonance. Some people notice light warmth like the beginning of a sun behind the brow. Others feel a quiet steadiness, like the hush before a bell rings. If the area feels closed, cold, or numb, treat this as an invitation, not a verdict. A closed feeling often indicates a habit of mind that protects by shutting down sensation. That protective closure is what we will work with. The second mark, the line along the outer edge of the hand. Trace it with reverence. This line holds information about perceptual extension, how you open to signs that are not purely external. When it is awake, you may feel a subtle tightness that relaxes when you breathe into attention, a faint tingle that responds to intention. When it is dulled, the hand can feel numb or merely functional, disconnected from the layer of perception that reads nuance. The third mark, the point above the sternum, the place of declaration. Rest your fingertips there and sense whether your inner voice feels authorized. Is there a small, ready authority that can say, "I know," without anxiety? Or is there a muffled hesitation, a throat that tightens when you consider speaking of inner things? This point is not about speaking loudly. It is about reclaiming the permission to declare what you perceive. These 3 points together form a simple diagnostic ritual: base of skull, receptive tuning; hand line, perceptual antenna; chest center, authorization to speak. Any small response across these sites is meaningful. Remember, you are seeking experience, not proof that convinces another person. Before I guide you through a fuller, slow ritual to begin a nightly practice, take a minute to consider resistance. As you touch these places, the instant thought that arises, "This is silly, placebo, I'm being gullible," is not a reason to stop. It is the interference making itself known. When you notice that thought, do not argue. Name it, then return to the sensation. This pattern, observe, don't debate, is crucial. The interference loves argument because argument reaffirms its authority. Observation disarms it. If at any point you feel discomfort physically or emotionally, release the touch and breathe. This entire practice is intended to be gentle. It is not a substitute for medical or therapeutic care. If anything you feel suggests a need for professional attention, honor that. Here is a practical nightly ritual you can try. It is short, safe, and designed to reinforce gentle receptivity rather than force any particular outcome. Do it lying down or seated once a day for 30 to 90 seconds in total. Consistency matters more than intensity. Begin by creating a small, quiet container of attention. Dim lights if that helps. Sit or lie comfortably. Breathe slowly 3 times, with a soft exhale that lets your shoulders settle. Step 1. Base of skull pause. About 30 seconds. Lightly place your fingertips at the base of your skull. Rest. Breathe into the area for a few slow breaths. Imagine attention as a slow tide that finds the place behind your eyes. Do not try to make anything happen. Allow a listening posture. If warmth appears, observe. If stillness appears, observe. If nothing appears, observe. The key is a non-demanding attention. Step 2. Hand line trace, about 20 seconds. Move one hand to the outer edge of the opposite hand and trace the line gently with your fingertips. Follow the skin, do not press. Let your gesture be like reading a line in a book, curious and calm. Notice any micro-responses. A soft electric sense, a change in breath, a small softening. Step 3. Chest declaration. About 20 seconds. Place 2 or 3 fingers on the hollow above the sternum. Lift your inner voice a notch and say, aloud or internally, a brief first-person declaration. The words should be simple, present tense, and felt more than believed. Choose from this 9-word declaration and say it aloud with steady breath. I remember my origin. My sight opens. I speak. Those 9 words are offered not as a magical incantation, but as a focused, embodied affirmation. A prayerful statement in your own voice. If any word feels foreign, adapt it to a wording that lands true for you in the present tense. I remember. I am seeing. I speak my truth. Speak gently. Let the vibration of the words be small and contained. After the declaration, rest your hands where they are and breathe 3 slow, quiet breaths. Close with a short thank you to yourself for the attention. That's it. If you felt anything at all, a spark, a warmth, a calm, that is worth noting. Over days and weeks, small signs may accumulate. They may also come and go. That fluctuation is part of the recovery of subtle perception. A few practical notes to keep this safe and grounded. First, this ritual is energetic and experiential, not medical. It is not a treatment for physiological conditions or mental health issues. Second, if your body resists strongly in any place, do not force it. Gentle curiosity always trumps force. Third, if modern discussions about environmental factors like fluoride, EMF, or calcification resonate for you, treat them as cultural conversations you may explore with professionals if desired. They are not necessary for this experiential practice. Fourth, this path can bring social awkwardness. Subtle awareness sometimes separates you from group norms. That is nothing to fear. It is simply a consequence of changing how you attend. Seek community gently. Find others who value inner verification. After several nights of simple practice, you may choose to extend the ritual by adding a moment of listening, simply resting attention at the base of the skull and allowing impressions, images, or sensations to arrive without editing. Do not interpret too quickly. The impulse to label an experience as supernatural or psychological is part of the interference. Let images be what they are. Mental weather, not truth locked in place. Over time, a steadier clarity can emerge. Now, for a moment of guided attunement. Place your hands as before. Fingertips at the base of the skull, one hand tracing the lateral edge of the other, and fingers rested above the sternum. Breathe. Allow a slow inhalation and exhalation. Feel the weight of your hands. Notice how the skin under your fingertips warms or cools. Notice the inner landscape of thought. If a critical thought arises, I'm making this up. Simply name it and return to sensation. This act of naming is part of your sovereignty. When you are ready, say aloud with calm conviction, feeling the words in your chest and behind your forehead. I remember my origin. My sight opens. I speak. Repeat the phrase slowly, 2 more times if it feels comfortable. Let the sound be simple. Let the words settle into the body rather than into argument. After you speak, rest your hands and breathe. Notice any small shifts. An eased breath, a micro change in inner clarity, a warmth that lingers. Even a single small change is a sign that attention has found its mark. If, at the end of this check, you felt even a spark, a small shift worth naming, I invite you to write the word recognition in the comments below. That is the mid-practice invitation. A single note to let others know they are not alone in registering a small movement. Do not feel pressured to report a grand experience. Even a minor flicker counts. It is important to restate what this work is and what it is not. What it is. A reclaiming of inner attention through embodied verification, informed by symbolic maps preserved in some ancient texts. The Nag Hammadi writings and the Gospel of Philip record metaphors and teachings that speak to dynamics of remembering and interference. They are offered here as a language to orient practice, not as incontrovertible historical reportage. What this work is not: a medical cure, a guaranteed fix, or a prescription for any physical ailment. If you are dealing with medical or psychological challenges, combine spiritual practice with appropriate professional care. Why bother with this? Because sovereignty matters. Being able to test your own inner states without always outsourcing meaning to authorities is a practice of freedom. The archontic patterns, as the texts frame them, thrive in dependency. In the habit of asking someone else to translate the whisper your body hears. Relearning how to listen to the whisper can dissolve habits of dependence one small moment at a time. There will be social consequences sometimes. If you begin to trust inner signals that contradict group consensus, you may feel isolated. That is a normal part of awakening. Cultivate gentle companions, people who will hold space for your experiences without insisting on verdicts. The aim is not to gather a following but to deepen inward sovereignty. Over time, you may notice that certain automatic skeptical responses become less urgent. That is a sign of integration. The interference no longer needs to assert with such force. You may also find that your relationship with information changes. You can use external sources without giving them final authority over your direct sensing. That balanced posture, informed but not mediated, is the dignity of a practiced pneuma. If you carry a faith tradition, you can hold these practices alongside it, provided you treat the Gnostic map as an additional lens rather than a rival orthodoxy. If you do not carry a faith tradition, treat the texts as tools, metaphorical maps to orient your inner navigation. Either way, the practice remains the same. Attention, gentle touch, naming of automatic dismissal, and a short present tense declaration. Before we close, a brief reassurance. The 3 marks once noticed do not disappear. They are not fragile trophies to be lost forever if you stumble. They are recurring sensations and capacities that respond to attention. Even one small evening of practice can leave a trace of memory that returns when you attend again. The reclaiming is slow and patient, not frantic. Now, close your eyes if that feels right. Take 3 slow breaths. Place your hands where you were guided, base of skull, lateral hand line, and hollow above the sternum. Whisper the declaration once more, feeling the words vibrate in your chest and behind your forehead. I remember my origin. My sight opens. I speak. Rest, and when you are ready, return to your day with a softer attention. Notice when the automatic dismissal arrives, and with compassion, name it. Remember that noticing is the first act of freedom. If this message landed on you in a way that feels alive, even slightly, and if you felt anything at all during the check, consider returning here for deeper activations. In the next session, we will explore gentle frequency work for grounding and how to refine your listening without chasing visions or manufacturing certainty. For now, simply practice the short nightly ritual for a week and observe what small changes occur. If you felt a spark during today's exercise, type the word recognition in the comments so others can see that a shared memory is stirring in more than one place. And if you want to continue, subscribe to follow the next activation where we will work with subtle grounding and refining the field around the base of skull without any complicated devices. You deserve to reclaim the dignity of seeing for yourself. The capacity to perceive is not something to be given by another, it is something to be remembered and tended. Be patient with the process. Trust small signs. Protect your practice with gentleness. May you learn again how to hear the soft permissions that live beneath the clamor. May you recognize the marks that belong to you. May your inner sight open in time. Not because it must, but because you are willing to come back to the quiet and remember.